Good evening, America. I'm the Big Red One guy, and I'm here to remind you that we must break the machine. Machine going on in this nation is a very, very dark place. It's a dark entity, and it right now it's currently rolling a former president through its guts. Anyway, wanted to run this article by you. What's behind America's doctors crisis? It's probably something that you didn't see in mainstream media, but there's an article by the Epic Times. And I believe it was dated, let's see, May 8th, actually. So even I missed it. It says, what's behind America's doctor crisis? Physicians are retiring in great numbers as burnout levels increase. At the same time, Americans are placing higher demands on the healthcare system. Yeah, that's because we overeat. We do all kinds of stuff that we shouldn't. We don't exercise. Definitely don't diet. And, what are you going to do? It's just America's like extremely fat. I know I'm part of the problem. Fortunately, like my insides are all good, and I'm doing what I can on a daily basis to make a change in my life. So that's a positive thing. It's gonna take some time. Didn't take time to put it on. It's just gonna take some time to take it off. Anyway, let's get into this. It says problems securing appointments to see doctors in the United States are exacerbated by soaring healthcare demand and fewer doctors. Gee, I wonder why we have fewer doctors. Many specializations are increasingly affected by this trend, but primary care and emergency medicine are among the hardest hit. And you know why we have fewer doctors? A lot of them are retiring. Okay. And we fired a whole bunch of them in between 2021 and today. Essentially, 2021 to 2022, we fired a ton of doctors, all because they didn't want to get the jabba juice or they disagreed with how things were being done by their hospitals, by the states, and there was silence. There were very, very, very. There was silence. There was a lot of pushback from doctors that we don't hear about. Okay, because thousands of them had they had concerns, plenty of concerns about the juice and about what was going on, the medical tyranny that was going on. Says the average wait time to see a doctor has increased since 2017 and continued to rise after the demand spike brought on by the COVID-19 pandemic. Well, when you fire your doctors and you fire your nurses and you fire your EMTs and your paramedics and you go right down the line, even to the medical assistant and everybody who takes part in taking care of a patient, okay, because they disagree with you on either religious grounds or personal grounds, this is what you end up with. S- Survey conducted by AMN Healthcare in 2022, 15 large metro markets revealed that the average time to see a physician was 26 days, an 8% increase from 2017 and 24% spike since 2004. Good old Obamacare catching up, huh? Remember, if you like your doctor, you can keep your doctor. Well, that was a crock of shit. Good old Obamacare is catching up. On top of the fact that what happened during the pandemic and what hospitals were doing and what states were doing and taking people's licenses, preventing people from having surgeries. Uh, People are that to this day there are still places that are not giving people transplants if they don't have juice in them. Staff constraints are also felt in hospital emergency departments. Nearly 140 million Americans visited a hospital emergency department in 2021. Well, I mean, on top of COVID, there was everything else going on too. We never got the numbers of just the regular flu and pneumonia. And again, like I said previously, all kinds of things were happening. Listen, COVID was a terrible thing. It was a high-powered flu that really, really, really did some damage to people, and particularly the elderly. Uh, it's kind of hard to deny how deadly it was. I know a lot of people tried to, but it was deadly to a lot of people. But it was also not so deadly to a lot of people as well. It was really mainly, the people with comorbidities. Sorry, I can't even talk right now, and the elderly. And there were some outliers, obviously with children. But even if you look at those outliers, you see many of them were kids that weren't really in shape. Where we started to see issues is when the juice was starting to be delivered, starting to, it was hurting a lot of young kids. Nobody wants to admit that. Uh, where are we? Staff constraints also felt in hospital. Yeah, I read that. Consequently, many patients leave before being seen by doctors. Yeah, because you're sitting there waiting and shit doesn't happen. Anyway, the Epic Times had a documentary called Flatline America's Hospital Crisis. And just here's a little 2 minute, 31-second snippet. It's kind of like it's an intro to it, really. Bit of a, what do you call it? Coming attraction.
Their motto is we care. They don't care.
He died in the ambulance.
Yes.
Almost 200 hospitals in America have closed in just the last few years.
You die. That's exactly what happened.
911, what's your emergency?
Hospitals have long been a place of confidence and trust.
I'll go back this far. Politics killed the hospital.
But what happens when hospitals across America close their doors?
All the good providers, the surgeons and so on, left.
It's a death in the community.
Having two hospitals and all of a sudden having none.
Very scary.
We're in a crisis here, aren't we?
Without question, we're at a crisis point.
When that hospital is no longer there, people die.
When we found out they was going to shut down, it was a really sad day here. Everywhere you went, people were crying. And
I had no idea how big the problems were facing American hospitals when I started this journey.
And it seems kind of hopeless. Nobody's making enough money to survive.
That if this hospital is gone, there will be a lot of lives lost.
A place that was alive with energy and doctors and nurses and patients and families. All empty now.
At one point, they had tunnels dug through the rooms.
It's become a magnet for criminals.
It's not an easy thing for a community to lose their hospital.
Wow.
It has crippled the community.
Hundreds of hospitals have already closed. Hundreds more are on the brink. They often find convicted felons, for example. And that's what I'm talking about right there. That's why the police are often nervous coming into these buildings. These hospitals, once the center of the community, are now a mecca for crime, a magnet for all the bad elements.
How do we get more jobs?
The whole community suffers financially, economically. It's devastating.
I mean, people spend money where they work.
And it's not just a Kennett thing, it's a United States thing.
I can't wrap my head around it in any way that government programs would under-reimburse a facility to a degree that it puts them out of business.
Why is it the hospitals in the rural areas are the ones closing their doors so fast? Well, the answers are complex, I can tell you that. And there's not just one.
Lives are lost when people have to travel farther to get to health care.
Well, with the rise of urgent care centers, that's and the change in how medicine is delivered. You have nurse practitioners and physician assistants across the country that are doing more and more, especially on the family medicine, internal medicine side of things. Uh, a lot of doctors are aging, they're aging out and retiring. I mean, it's easy to find. You can just take a look and look it up. Again, what happened during COVID didn't help, but there are other factors, of course, too. It wasn't just a pandemic, when we lost a lot of doctors, but you know, um, they just don't see a lot of doctors are just like giving up. They don't see the worth in taking care of people anymore, which is sad. You know, they're not. Some of them are not getting paid. Obviously, not all of them. Plenty of high paid doctors in this country that still exists, especially if you're a surgeon, neurosurgeon or something like that. You probably make decent money. But I know that uh, family medicine doctors don't really make that much money. I mean, they obviously make more money than the average citizen, but they don't make that much. If you look at the grand scheme of things, and the insurance companies haven't helped anything out either. Uh, people in America have been fighting with insurance companies since the birth of HMOs and PPOs and everything like that. Medicine in this country died when we went to the insurances. People will say, well, we're able to get more coverage, but getting taken care of by a doctor was a personal thing before that. Once it became a business, once the insurance agencies came in, it became a business. And it's just sad, man. Really, really sad. Says one study analyzed more than 1,000 hospitals between 2017 and the end of 2021, found that those with the worst performance had a 4.4% of emergency room patients leave before a medical evaluation was conducted, probably because of wait times. At the end of 2021, that number had risen to more than 10%. People were showing up for COVID 2021. I was still in the middle of the pandemic, so I'm pretty sure the waits were compounded with just the mass amount of people that were showing up in hospitals who were sick. Compounding the issue is that nearly half of the doctor population will reach retirement. I was just saying that age within the next 10 years, and career burnout is hitting the rest harder than ever. Yeah, a lot of doctors got burnout. Not just doctors, nurses, man. It's really the nurses. Okay, they need to do something about you know the nurse shortage in this country because they're the ones who have more uh what do you call it, connection to the patients than the doctors. The doctors have to they come in, they see a patient, 15 minutes, they're out. The nurses have way more interaction with patients. And they're the ones that are carrying out the orders of the doctors. So shout out to any nurses who are out there. You guys are really, really underappreciated. There's almost 50% of doctors report that they feel burned out, according to a 2024 Medscape report. These are factors driving the United States' growing scarcity of doctors. Physicians thrive. 2023 study stated that the United States may have a shortage of 124,000 doctors by 2034. It's a lot. Within that shortfall, up to 48,000 would likely be lost from primary care. Like I was saying, that's like family medicine, primary care. It's kind of the same thing. While the industry is projected to lose another 58,000 specialists. Holy shit, surgeons and nurse practitioners. I remember I was saying about nurse practitioners and physician assistants. Um, they're the ones that are going to be kind of taking up the primary care the way this is going. Uh, but if they're losing nurse practitioners, that's bad. Like I said, nurses do a lot of work. This is definitely coming down the pipeline. Emergency physician Dr. Jared Ross told the Epic Times, it's been coming for a long time, and we're seeing this all across healthcare. Goes on to say Dr. Ross is also president of that's where that Kenny is, Missouri. President of Missouri-based Emergency Medical Services Education and Consulting. Has watched the United States healthcare worker crisis unfold on the front lines and said the shortage of physicians is an old problem that's reached a tipping point. We've talked about this for years. It's nothing new. There's been a number of attempted stopgap measures that haven't been all that successful, he said. These These provisional solutions include bringing in more practitioners from foreign countries. They're doing that with like everything, not just doctors. Introducing medical school loan forgiveness programs. That's like when you go through medical school. It's like a loan forgiveness, not like the shit that Biden's trying to do. It's essentially, you know, um, you become a doctor, get all this freaking you get this huge loan because you're essentially in school for 8 years, and then you don't get paid until you get into residency, and even that is probably shit pay. So that's when you have to start paying your loan back. But you don't make enough as a resident, especially your first year as an intern. Um, you just don't make enough. And what the loan forgiveness does is these groups and these hospitals, these big hospitals that are trying to get these younger doctors to come in, they say, hey, uh, come here, come do your residency here, and then stay with us, and we'll pay for your loan. We'll pay your loan off. And then listen, it's a billion-dollar industry, healthcare, so it's not like these places don't have the money to do it, but it's just not enough people going to med school. It's not easy getting through med school. I know. I have a doctor in the family, and it's not easy. Dr. Ross said he has seen doctor shortages affect emergency medicine, but noted that primary care has really struggled to retain physicians. That has always been the issue, as far as I know, going back a long time. This is critical for two reasons. One is that healthcare demands in the United States are rising. It's because we're an unhealthy nation. The average number of times Americans visit a doctor per year is like 4 times for adults, 9 for infants, and 2 for children between the ages of 5 and 15, according to Vanguard Medical Group. Like, I have like routine appointments with my specialist, but my primary care, I don't see my primary care. I see him once a year, and I'm a fat bastard trying to lose weight. Problem is we have insurance system that is massive bureaucracy. Ain't that a freaking Jesus, that's the truth. Dr. Jared Ross, emergency physician. The other reason is what Dr. Ross called the corporatization of medicine. Yep, it's a business now. Problem is we have an insurance system that is a massive bureaucracy, he said. Dr. Ross said that at a recent conference with other medical leaders, it was discussed that the United States has really pushed away from the model of traditional healthcare. There was a general consensus within that group that insurance companies have become too powerful in medicine. He said, I mentioned that earlier. Once the insurance industry took over, how medicine is actually practiced, doctors can't do doctors have to do things in a certain way because the insurance companies, okay? Doesn't mean that, again, like doctors aren't making their money and stuff like that, but they have to practice a certain way because the insurance companies won't approve a lot of the stuff. In most cases, okay, I know this from the doctor in my family who I've had discussions with this about, okay, he's mastered how to freaking avoid a lot of the bullshit that the insurance companies put doctors through, okay? Because like they make them order these stupid tests that just like you know, a lot of times don't even relate, okay, to what he really needs to do. And he finds a way to when he does his rule out, because doctors just when they do testing, they're supposed to do what's called a rule out, okay? And they do tests to rule things out, right? And when he does it in such a way and he's learned how to code his stuff so that he doesn't have to go crazy with all the tests. Uh, um that the insurance companies require them to do. It's like you have to do this first before you could do this. So he finds ways to try to get around some of that. Obviously he can't get around it all the time, but he does the best he can is to help the patient so they're not burdened with such a heavy cost and stuff like that. Obviously, he's a really good doctor, uh my family member, and he goes out of his way to help his patients. He's very, very in tune. His bedside manner is incredible. Says the administrative burden or hassle, as many doctors describe it, is very disheartening. Dr. William Schaffner, Schaffner, I think it is, an infectious disease specialist at the Vanderbilt University Medical Center, told the Epic Times. Having worked in medicine for more than 40 years, Dr. Schaffner has witnessed it evolve to something aggressively more complicated as insurance companies expand power over doctors. It's ridiculous. He said this trend became more noticeable by the 1990s. Remember, I was telling you? I think the insurance thing started to become a thing in the 70s, but people didn't really have it, right? Like it was still very, very personal when you went to go see your doctor. Okay. You didn't have to, you know, you didn't have to get a referral, right? You went to go see your primary care physician. And if you needed to see a cardiologist, you just went to the cardiologist. And there was a connection between the primary care provider and the cardiologist. And he was like, I want you to go see this doctor. Okay. Because they had a relationship. Okay, a business relationship essentially. It's like, hey, I'll send my people to you because you're a good doctor. Now with your insurance company, if you had a good doctor, after Obamacare was signed, many cases, many people lost their doctors, and they had to, the insurance, with their new insurance, they had to go ahead and find new doctors, so it's tough. And in rural areas, they mentioned in that video, it's very, very tough. Medicine is incredible. The rural areas have been struck with an absence of medicine for a very long time. People usually have to travel long distances to get healthcare. It's a very, 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 very harsh thing. Doctors didn't go to medical school in anticipation of arguing with insurance companies. It's depressing and discouraging, Dr. Schaffner said. In 2020, for the first time, less than 50% of U.S. physicians worked in private practice. Oof. According to the American Medical Association, most have chosen to become employees of large medical groups, which has drastically changed the excuse me, sorry, paradigm of health care. Sorry, people. The shift away, I hurt. The shift away from independent practices is emblematic of the fiscal uncertainty and economic stress many physicians face due to statutory payment cuts and Medicare. Medicare is just a nightmare. That's the government paying doctors back, and they're like, the doctors they bill an exorbitant amount just so they could get half of it. They have to overbill so they could get what it actually costs because Medicare is just a disaster. with payment, and they take forever to pay doctors. So a lot of doctors, including primary care physicians, stop taking Medicare. And that hurts the elderly. Geriatric patients, it hurts them a lot. The shift away from independent practices, emblematic of the yeah, I read that. Okay. Phase two to statutory payment cuts in Medicare, rising practice costs, and intrusive administrative burdens, AMA President Dr. Jesse M. Ernfeld said in a 2023 statement. Battling with insurance. Anyway, I read this article, and this insurance thing is just, it's crazy. Okay. Um, it's gone on with what's happened is medicine has become a conglomerate, right? It's really, really like pretty big monster right now. Uh, and you got these big, huge medical groups that they're going around and they're buying up these smaller offices and stuff like that, and smaller practices, and turning them into a big group. So now you have the insurance, which is one issue of bureaucracy. Then you have these huge medical groups in many cases not being led by doctors and being led by administrators. Okay, people who've never practiced medicine. Um, Either they were failed doctors or they just got a freaking PhD or a master's in something, and got the job to administrate, but they know nothing about medicine, and it becomes an issue, and it becomes a problem with fighting back, okay, and giving proper care. Well, that's something else to know the crisis. We have a shortage in this country with doctors. That's a bad thing, not a good thing. And to mitigate that, what's happening is that a lot of med schools are going to the DEI practice, where they're just getting people for the sake of getting people by the color of their skin or whatever it is, and we need such and such amount because they get quotas, because DEI is just a racist thing anyway, uh, and they're getting unqualified people. You know, they're taking people who aren't scoring well on the MCATs. The MCATs is the entrance exam into medical school, and it's a barometer of how well and how intelligent somebody is, and how they can understand science, essentially, because medicine is science. Okay. And they're just taking people off the freaking streets. Like they're going down to the fucking hood on a corner and getting like, you look smart enough, come here. Or they're going out to the middle of nowhere. It's a bumblefucked Egypt, and like, you look smart, come here. And then they might not necessarily have the mental tools to get through med school. Because it is not an easy thing becoming a doctor. Or for that to becoming a nurse. I have some friends who are nurses, and their schooling was harsh. I got a nurse in my family. Schooling was harsh. Medicine in general, whatever anybody's doing in medicine, there's always some kind of harshness to it. Okay, and tough. It's tough to get through a lot of these schools. From on every level of medicine, it's not an easy thing. You have to be able to not only learn things, but you have to be able to put them into practice. I know that the doctor in my family has told me that, uh, he came out of med school, and like like I would say, he said like 70% of the stuff I learned in med school didn't apply when I came out. I had to like relearn. He was like, I had to relearn everything, and learn it differently. And he said I had, ruthless attending physicians who were over me and demand things a certain way. And he lived through it, and he made it. And that's what it is. And he said, and he's still learning to this day. He stays up on whatever he can. He says, because medicine changes dramatically. But shout out to our physicians out there. Shout out to our nurses. Shout out to any PAs or any nurse practitioners. So EMTs, paramedics, medical assistants, anybody who's in the medical field, okay, and is feeling this, because when doctors aren't there, everybody's feeling it. Okay. When nurses aren't there, everybody's feeling it. It's just like it's a big web. Medicine is a big web, the practice of medicine. There are so many people that are involved in the care of another human being, that it's not just a doctor. There are so many other people that have interaction with the patient that's not doing well. And there is a shortage across the whole country with this, and we're headed for dark times if we don't get this fixed. So anyway, everybody, hope you're having a great day. Hope you're going into the evening and as well. Prayers to everybody's family out there in the world. America's headed to some dark times, but I have faith. I have faith in all of you out there that we can get it done. It's gonna be hard. Don't listen to the black pill. Once again, I'm the Big Red One guy, signing out, and always remember to break the machine.